Hello everyone. Alright, buckle up because now we are going to be talking about newborn care and neonatal disease, and this is a subject I'm super passionate about, so you better believe we are going to be covering a lot of material. Unfortunately, I really don't think that this is my best piece of art, but we'll just ignore that part because it'll give us a chance to talk about cute little babies. I've just finished up a month of working in the newborn nursery, so I've got lots on my mind. In terms of the art itself, it was pretty tricky to think of something to represent an entire newborn, so I ended up basing this piece on an ultrasound, which is actually a lot harder than it sounds. Ultrasounds are already pretty tricky to make sense of without training, and trying to translate that to this stylized art was even harder and took a lot of figuring out. You might even notice that for the first time on any of these pieces, I've actually brought out a white acrylic paint marker to use as whiteout too, which I'm a little embarrassed about, but I think it was finally necessary. Part of the issue is that in an ultrasound, there is an element of transparency to things. So when I first drew this, I drew both feet, and the bones of both feet were visible, even though they were placed one in front of the other relative to the viewer. Unfortunately, I just don't think that I was able to clearly communicate the overlapping feet in this context without it looking like a weird mistake. So I eventually went back and covered up the foot behind to clear it up, and then used a couple other touch-ups too, just for good measure. I also thought I would try something new with the background based on some other optical illusions I'd seen before, and again, somehow I just feel like the effect didn't really translate the way I wanted it to, and then I also don't love the way I ultimately chose to have the pattern go through the uterine lining, or perhaps to have included the inner wall of the uterus at all. Oh well. Now, what would you say if I told you that there was a supplement you could take that would reduce the risk of death from any cause by 14 times during the next year? I kid you not, people would literally be breaking down our office doors begging for the chance to get some of this miracle cure. Well, I also kid you not when I say that we already have this miracle supplement and it wasn't made by doctors. It's called breast milk. You heard me right. Infants in the United States that are exclusively breastfed are 14 times less likely to die of any cause in the first year of life. You heard me right. It's absolutely insane to think about. I mean, if there was literally anything you could do to make your child 14 times less likely to die, you would be absolutely insane not to do it, right? And yet we face this issue all the time. I will literally tell this to parents of newborns on day 1 of life, and they'll say, "Wow, that's crazy," and then go on formula feeding like nothing happened at all. And when I ask them if there's any particular reason why they're formula feeding, they will literally have no answer or justification. They'll just say no and then resolutely go on making a worse choice for their child's health. Well, let's talk a little more about why it is that breastfeeding is so good for babies anyway. Lots of people think that breast milk is just food. Wrong. Dr. Buescher from Eastern Virginia Medical School may have said it best when he said that human milk is a complex, specialized, and sophisticated human infant support system that provides protection, information, and nutrition to the nursing infant, not just food. This stuff is specially designed just to keep babies alive. One of the ways that you've likely heard of before is that breast milk provides immune support. This happens because mother's antibodies can be transferred into the breast milk, effectively providing a full adult's worth of hard-earned immunity directly to the baby to protect them while they are still vulnerable and their immune system and body are still maturing. There's literally nothing else in the world that we have that can replicate this effect, and it is absolutely essential to help keep baby from getting sick. Another interesting thing we mentioned was communication. Breast milk also contains signaling molecules that help control organ development, heat production, brain development, food preferences in childhood, and help develop a normal, healthy gut microbiome. Again, these are only present in breast milk. Another thing that breast milk can do is change throughout the course of the day. It has been shown that when it gets closer to night, that the mix of amino acids in breast milk change to include more tryptophan, which helps baby produce more melatonin and develop a healthy circadian rhythm, literally meaning that breast milk at night will help baby sleep better, which also means it will help mama to sleep better. Those are just some of the benefits to baby, in addition to being the best protein shake they could ask for in terms of nutrition. The benefits of breastfeeding don't stop there though. it also helps out the mother. Breastfeeding is energy intensive, and producing breast milk helps with maternal weight loss after pregnancy, and has been strongly associated with reduced risks of type 2 diabetes, high blood pressure, and cardiovascular disease. Furthermore, the hormonal changes associated with breastfeeding also help reduce the risk of breast cancer and ovarian cancer. The oxytocin from breastfeeding helps recovery after birth by promoting uterine contraction and decreasing uterine blood loss, and it is also a natural, although I absolutely would not rely on it, way to reduce the likelihood of pregnancy and increase birth spacing. Breastfeeding also helps reduce the risk of postpartum depression by increasing oxytocin and prolactin levels, improving mother-child bonding, and I would also like to point out that the skin-to-skin contact promoted by breastfeeding is really good for babies' temperature regulation and stress reduction. It always breaks my heart to see babies set aside in a crib, wrapped in a blanket with a bottle in their mouth instead of being held up to cuddle on their mother's chest. Well, Dr. J. Player, you may say, that's all well and good, but what about people who can't breastfeed? And to you, I say, that's actually only true for a very small minority of people compared to the number of people who can and should breastfeed but do not. Some of the more common things that will truly stop breastfeeding include breast surgeries that sever ducts or nerves, like a breast reduction or mastectomy, active drug use, active infections like untreated HIV, taking necessary medications that aren't safe to breastfeed with, or a history of hormone-related fertility problems on the mother's side. On the infant side, some true hurdles center around the inability to extract milk, which may occur in very premature or small newborns, those with oral developmental problems like a cleft lip or palate, medical problems like infections, and neurological problems. There are many other things that can make breastfeeding more difficult, however, such as maternal obesity, low or high maternal age, breast implants, hormonal problems, a need to return to school or work early, mental health issues, being a first-time mother, and some anatomical differences in the breast or nipples, although most of these things can still be overcome with dedication and a commitment to exclusively breastfeed, and I strongly advise seeking the help of a lactation consultant for anyone having difficulty. There are a lot of myths surrounding breastfeeding, so let's talk about that. Something that you may hear remnants of is that formula is healthier for babies, or something along those lines, because formula companies pushed that narrative decades ago until they were largely scienced into oblivion. Now, the evil whisper in your ear that you'll hear much more commonly is that sure, breast milk is good, but you might not have enough. Myth. Unless you're in one of those rare exceptional categories I mentioned before, this simply isn't true. I think I see this most frequently with new mothers who start to nurse on day one, but are distraught because they feel like their milk isn't coming in, and they then end up formula feeding instead. This is simply giving up too early. The truth of the matter is that it does take some time for milk to come in, but the colostrum that comes first is highly nutritious for babies, and babies usually only take about 5 milliliters of breast milk on the first day of life anyway. Not only is this normal, but it's actually very important, as breastfeeding the baby, even if it's only colostrum, is what will help stimulate the rest of the breast milk to come in and increase production. Whereas if you quit too early, the positive feedback loop will never have the chance to fully start. It really takes a couple of days for the quantity of breast milk to increase significantly, and multiple early breastfeeding attempts are what helps stimulate that milk to come in. Another common myth is that breastfeeding should hurt, which is simply not true. And if it is hurting too much, then that may be a reason that a mother is reluctant to or chooses not to breastfeed. The truth is that if breastfeeding is hurting, then most likely the baby's latch isn't very good. Most often this is because not enough of the breast is in baby's mouth, only the nipple is, when really the nipple should be reaching back towards the back of baby's throat near the palate, sparing the nipple from excessive pressure. If breastfeeding is causing a lot of pain, then again, I would strongly recommend meeting with a lactation specialist to help with troubleshooting. Another myth is that you'll have to stop breastfeeding if you go back to work or school, or whatever you may be doing. This one is admittedly a bit more tricky, because it is definitely harder to accommodate, and I recognize that resuming normal activity is rarely a mother's first choice. However, I say this is a myth because even if separation from a newborn is necessary, pumped breast milk can still be fed to them. Federal law in the United States requires workplaces above a certain number of employees to make reasonable accommodations and provide a separate room that is not a bathroom for pumping breast milk, and they are required to pay through the time spent pumping milk. Pumping will allow milk production to continue, and milk can be stored and saved so that it can be provided to the infant wherever they are being watched. This brings me to another point I'd like to mention. I would say that the majority of new mothers I talk to say that their plan for feeding baby is breast and bottle, meaning formula, which I feel like is kind of a default answer most of the time, meaning that yeah, they want to breastfeed, but if it feels inconvenient, then maybe they'll throw on a bottle just to be safe. Well, I'll just go ahead and say it. Breastfeeding requires a full commitment. In almost every case, people who say they want to do both will end up exclusively formula feeding instead. And why might that be? Well, it probably has something to do with the fact that baby formula by dry weight is about 50% straight sugar. Yeah, you heard me right. Far sweeter, far more fattening, and far less healthy than breast milk. So that baby is very quickly going to learn to prefer formula instead of breast milk because it tastes so much sweeter, and eventually they won't bother taking breast milk at all, which benefits formula companies just fine. The more addictive their product, the less breast milk babies drink, the more they sell. This brings me to the next point I'd like to make. Formula companies are mostly evil. They make a product that they know is far inferior to breast milk, one that actively harms babies in the strong majority of cases. Remember, exclusively breastfed infants are 14 times less likely to die from all causes in the first year of life in the United States. And they do everything in their power to sell more product anyway. We have made some progress on this front, but I assure you they will stoop as low as they can. Their old claims used to be that it was better than breast milk. Now that that is no longer an acceptable claim, they sow doubt instead, telling mothers that they might not have enough breast milk, discouraging them from feeding, all while knowing full well that their product is addictive and will stop babies from taking breast milk if they can just get them to start. They do everything in their power to move their product. They give out coupons and free samples and will mail it to your house before your due date, so you have some waiting at home for you to feed baby first thing when you get back from the hospital. When it was allowed, they used to give it to you right in the hospital. They'd have advertisements placed in maternity wards, with pseudoscientific posters hanging on the walls touting the benefits of formula. They'd give it to nurses and teach them to shove formula bottles down babies' throats so moms could get a rest instead, and they'd hand out goodie bags with formula to take home. Now, most of that isn't allowed anymore, and if you see any of it, you should go and deliver elsewhere, but they would still be doing it if they could. I mentioned formula companies using pseudoscience to move product, so let's get into it. For anyone curious, there's a really great series published in The Lancet called the 2023 Lancet Series on Breastfeeding, which is largely what I'm referencing here, in addition to some personal anecdotes and lectures that I've listened to. One of the common formula company playbooks is that they will teach mothers that anytime a baby is crying, it's because mama isn't making enough milk, or their interrupted sleep pattern is due to insufficient milk. The truth of the matter is that crying is a multifaceted form of communication that can mean many things, and babies cry and sleep differently than adults because they are not adults. Other lies they spread include that formula will cure fussiness and improve intelligence, which is again false. In more modern times, formula companies pay influencers to talk about how hard breastfeeding is and sell formula. They pay for parenting apps with ads promoting formula, and they lobby to influence policy. Things are so out of hand with formula companies that the World Health Assembly has literally developed an international code of marketing of breast milk substitutes. But because enforcement of this code is voluntary, these companies literally violate it all the time with limited consequences. Another reason formula companies suck is that they specifically target emerging markets. For those of you outside of business speak, what this actually means is that rich formula companies like to push their product in poor countries because their advertising dollars get more bang for their buck there, and it is easier for them to fight against lax regulations in less developed countries. So instead of doing the right thing, they target the poor who may not know any better, flood them with false or misleading advertisements, and make them feel like they're bad parents if they don't feed their kids formula. Then, if it comes to that, they will gladly pay whatever legal fees they need to pay off the lawyers, policymakers, and anyone else to make sure their business goes unhindered. Now, this is also purely anecdotal, but I believe that we can still readily see the holdovers of targeting emerging markets here in the United States. I haven't specifically looked into any data behind it, but at least in my own personal experience and that of some of the neonatologists I've worked with, there is a much higher proportion of Spanish-speaking patients who come in planning on formula feeding instead of breastfeeding, and I am strongly suspicious that this is a side effect of formula companies having targeted markets in Central and South America historically. So, we've covered pretty well why breast milk is amazing. Let's talk a little more about why formula is not only bad for replacing it, but also some of the reasons we know it's bad in general. We've covered the fact that it is extremely sugary and addictive already, so perhaps it shouldn't be surprising that babies that are formula fed are also at an increased risk of long-term metabolic disease. I mean, just imagine, right out of the womb we are effectively programming these newborns' brains to have a sugar addiction. What could go wrong? Well, what could go wrong is that it is very well documented that formula-fed infants have an increased risk of childhood obesity and insulin resistance, meaning a higher risk of type 2 diabetes, and evidence suggests that this risk continues into adulthood, although studies on this are more mixed. For lactose-reduced formulas that contain corn syrup solids, it's bad enough that there is literally a 10% higher obesity risk at 2 years of age. And don't buy into the high-protein hype either. High-protein formulas have been found to increase the risk of obesity and unhealthy weight gain too, with low-protein formulas actually significantly reducing the risk relative to the high-protein ones. Moving on from formula and breastfeeding, there are a lot of things that can go wrong during the development of a new baby. Some of these things can be random, some genetic, and some preventable. Drug exposure is one of the most common things that can cause issues during development, and the exact effects can be variable depending on dose, timing, and frequency. Perhaps one of the most well-documented and most devastating exposures is alcohol exposure, which can have serious effects on developing newborns, especially earlier in the pregnancy when the brain and nervous system are developing. This can lead to fetal alcohol syndrome, which can have lifelong negative effects on mood regulation, cognitive function, including memory and attention, growth, and it leads to distinct facial characteristics. There is no known safe amount of alcohol during pregnancy. Exposure to methamphetamine in utero, meaning while in the uterus, is associated with a low birth weight, preterm birth, cognitive impairments in problem-solving skills, short-term memory, language development, and issues with inhibition and attention, in addition to withdrawal symptoms at birth. For the record, there is no known safe amount of methamphetamine for anyone at any time. Opioids are another common prenatal exposure we see, and opioid exposure is associated with higher rates of preterm birth, neonatal death, and growth restrictions. As they grow, these children have also been shown to have cognitive, language, and motor delays, with increased risk of attention disorders and behavioral problems. We commonly see these children withdrawing after birth, and have to care for them while they recover, which is very sad. For mothers that are on prescribed opioid therapy, like methadone, Suboxone, or Subutex, it is recommended to continue therapy under medical supervision despite these risks, as the risks and outcomes are far worse for children being exposed to street opioids without medical supervision. Another common prenatal drug exposure we see is cocaine, which is also associated with growth problems, preterm birth, microcephaly, meaning small head size, and other serious congenital brain, eye, limb, and sex organ abnormalities. Cocaine constricts blood vessels, which is part of the mechanism behind some of these serious developmental concerns, and it can also lead to brain bleeds and serious cognitive deficits. Cocaine use is also notoriously a risk factor for placental abruption, which is an emergency for both the mother and baby as the placenta can detach and lead to serious blood loss. Probably the most common prenatal drug exposure we see is marijuana exposure, or THC. Like all the other drugs, except for prescribed opioid maintenance therapy, it is strongly recommended to not use marijuana while pregnant. Marijuana exposure is associated with low birth weight, smaller head size, preterm birth, and differences in brain development. Exposure is associated with attention problems, social problems, higher rates of intellectual disability, and possibly even autism spectrum disorder. Some of this data is still more mixed, as these studies are somewhat newer, but again, there is no known safe amount of cannabis use during pregnancy. THC can also be spread through breast milk, and the recommendation is absolutely to stop using marijuana while pregnant or breastfeeding. However, if a mother still plans on using marijuana anyway, this is still not considered a reason not to breastfeed, as although there are risks associated with this exposure that the mother should be educated about, the benefits of breastfeeding are considered to likely outweigh the harms of not breastfeeding, at least for the time being. Infections while pregnant can also cause serious developmental problems. A common acronym we use to remember the main ones is TORCH, or torch infections. The T is for Toxoplasma gondii, which causes toxoplasmosis. This can cause developmental problems with the eyes, calcifications in the brain, swelling of the head, liver, and spleen, and seizures. One of the common ways this is spread is through cat feces, which is why you may have heard that pregnant women should never change kitty litter. Fun fact. The O in torch infections stands for other, which can include chickenpox, which causes intellectual and neurological disabilities and seizures, parvovirus, which can cause hydrops fetalis, which is a serious swelling disease, Zika, which can cause seizures, developmental delays and death, and HIV, which can lead to AIDS, just to name a few. The R in torch stands for rubella, which is a vaccine-preventable disease that can cause permanent hearing loss, visual impairment, and intellectual disease. The C in torch stands for cytomegalovirus, which is one of the most common causes of hearing loss in newborns, although it can also cause visual impairment and other cognitive deficits too. The H in torch stands for herpes simplex, which causes brain disease and death in up to 70% of cases if untreated. This is by no means a comprehensive list, but it's at least a good place to start. Let's move on to discuss some of the things that we do after the birth of a baby as normal standard of care. One of the first things we give baby when they are nice and stable is a shot of vitamin K. Vitamin K helps promote clotting, reducing the risk of bleeding. In the body, the liver is what normally produces clotting factors and prevents unhealthy bleeding. But in newborns, it can take a couple of days for their livers to get up and running all the way. Vitamin K shots are a way to help bridge this gap and prevent dangerous bleeds from occurring. Although this can apply just to small bleeds like umbilical cord bleeds or the bleeding associated with circumcision, it can also apply to bleeds inside the brain, which occurs in over half of babies that bleed due to vitamin K deficiency. The risk of bleeding can be around 1 to 2%, which may seem like a low risk for people who like to gamble with their lives. But in the practice of medicine, that level of risk is unacceptably high for something that is easily preventable. Another one of the first things given to babies is erythromycin eye ointment, which prevents something called gonococcal ophthalmia neonatorum, or an infection of the eyes caused by gonorrhea that can lead to scarring and blindness, with transmission rates of 30 to 50% from infected mothers to babies who are not treated. The infection is rapidly progressive, which is part of why treatment is given at birth. While there are some national level discussions about whether or not universal preventive treatment should be given, as the incidence of the disease is quite low now due to prenatal screening, it is still currently recommended for everyone due to the severe consequences associated with infection. After these treatments, the standard of care for newborns is to get several screenings before they leave the hospital. This includes a hearing screen to ensure there are no hearing problems, a pulse oximetry screen that assesses blood oxygenation in the upper and lower body, and a newborn metabolic screen that tests for rare genetic conditions. As I mentioned earlier, the liver in newborns is still getting up to speed, so we also monitor bilirubin levels, which are normally processed by the liver. If bilirubin levels get too high, they can cause jaundice or yellowing of the skin. A little bit of this is normal, but if they get too high, they can risk causing brain damage, so phototherapy or shining bright blue lights on baby skin to break up the bilirubin may be necessary. We also administer the hepatitis B vaccine at birth. Hepatitis B is a liver infection, and 90% of newborns who are infected at birth will develop chronic infection, and about 1 in 4 of those with chronic infection will eventually end up dying from liver cancer or cirrhosis later in life. Newborns are much more susceptible to this disease, as in adults, exposure leads to chronic infection in only about 5 to 10% of cases, rather than 90% in newborns, which is one reason why we administer it so early. For mothers with active hepatitis B infection at delivery, antibodies will also be given to the newborn at birth as well to help prevent chronic infection. There are actually some really amazing graphs out there to look at, showing how the rates of hepatitis B fell drastically, first after the vaccine was developed, then after screening and pregnancy was recommended, and then even more when newborn vaccination was recommended. with really fantastic results. Another shot you may have heard about before is RSV. RSV is a respiratory virus, or a virus that infects the lungs, and is particularly dangerous for newborns. For women who receive the RSV vaccine during pregnancy, their antibodies will transfer over to the baby, so no shot is recommended for the baby. However, if the mother did not receive the RSV vaccine, then a shot of anti-RSV antibodies may be recommended for the baby to provide them with protection after birth. RSV is particularly prevalent during the winter season, so immunization may not be recommended for children born during the summer. Newborns account for about 20% of all RSV-related deaths in the first 6 months of life, so they are particularly susceptible. Having worked in a pediatric emergency room, RSV is very common, with studies showing about 2 to 3% of infants hospitalized with RSV in the first year of life. I sometimes have curious parents ask about what I'm checking for when I do a newborn physical exam, so here's a quick breakdown. I check the soft spots to see if there's concerning swelling indicating pressure inside the skull, or to see if there's a developmental abnormality. I check the eyes for the red reflex to make sure there aren't any cataracts or tumors. I check the mouth to make sure there is a good suck reflex and no oral abnormalities. I check the collarbone for fractures. I check the Moro or fall reflex to make sure there aren't nerve injuries affecting the arms. I check for concerning lung sounds or other abnormalities like a pneumothorax or a collapsed lung. I check the heart for murmurs. I check the grip reflex and muscle tone. I check the belly for tumors or abnormal liver or spleen size. I check the belly for umbilical hernias or cord problems. I check the hips for developmental problems of the hip sockets. I check the genitals to make sure everything is formed correctly and to make sure that I can find the testicles, as sometimes these are hiding up higher, and if they don't descend, that could signal a variety of different problems. I check the anus to make sure that there is a hole there, because sometimes the hole is not properly formed. I check the bottoms of the feet for symmetric reflexes. I check the back and the butt for any problematic dimples or sacral abnormalities that can signal spinal cord problems. I check spinal muscle tone because a genetic condition called spinal muscle atrophy can occur. I check the numbers of fingers and toes, and I check the general appearance for things like rash, behavior, and oxygenation. This exam is repeated multiple times because some changes over time are to be expected, and for this reason, it isn't out of the question for the outpatient pediatrician to notice something that wasn't remarked on by the pediatrician taking care of the newborns in the hospital either. Other general education that we provide to all parents include proper umbilical cord care, which involves things like keeping the cord nice and dry and folding down diapers so it doesn't get stuck inside, get wet, and increase the risk of infection. A healthy dry cord should fall off within a couple of weeks normally. Also, some cultures have a practice where they may put a coin on the end of the umbilical cord, especially with a home birth, and please never do that, because that's a buzzword on medical school exams for giving tetanus to a newborn. We also always talk about safe sleep, which means putting baby to sleep in their own bassinet, not sleeping with parents, putting them to sleep on their back, and wrapping them up nice and tight without any other blankets or pillows or stuffed animals that might suffocate them nearby. Don't fall asleep with baby, as they can slide off and get suffocated by pillows and blankets, or they can fall off the bed and get hurt. We also talk about signs and symptoms of infection, because even late infection can occur, especially in mothers positive for GBS or Group B strep, even if they were treated. These symptoms can include lethargy, refusing to eat, fussiness, color changes like getting really pale, breathing difficulties, and any temperature of 100.4 or higher via rectal thermometer, which is never normal in a newborn and merits a trip to the emergency room. Finally, just for funsies, here is a non-comprehensive list on why it is a terrible idea to do a home birth, but just for babies this time. Maybe I'll talk about why it's bad for mothers too another time. It turns out the doctors do a ton of things to take care of babies, and just because someone doesn't know what those things are, isn't able to understand the risk, or has poor judgment, it doesn't mean that those things won't still hurt or kill their baby all the same. So, in no particular order, baby can be born with a cord wrapped around their neck, which if not reduced by someone properly trained can kill them. Baby can be delivering with umbilical cord prolapse, meaning part of the cord coming out first, which typically needs to be converted to an emergency C-section in order to save baby's life. Baby can have a shoulder dystocia, meaning their shoulder can get stuck coming out, which can lead to permanent nerve injury or death if not managed appropriately. Baby can aspirate meconium, meaning inhale their pre-birth poop into their lungs before coming out, preventing them from opening their lungs enough without deep suction and causing respiratory failure. Baby can have acute respiratory distress syndrome due to immature lungs and require medicine or oxygen support in order to survive. Baby can get sepsis due to mama being GBS positive and not getting adequate antibiotics during birth, leading to death. Baby can get an infection due to prolonged rupture of membranes leading to serious illness or death. Baby can get kernicterus and brain damage due to jaundice levels getting too high. Baby can have a potentially fatal bleed in the brain due to not getting a vitamin K shot. Baby can go blind due to not getting erythromycin eye ointment. Serious heart, hearing, or metabolic disease can be missed due to missing newborn screens that can lead to disability or death if baby has poor medical follow-up. Baby can get congenital hepatitis B and die from liver failure or liver cancer due to mom not being screened or missing vaccinations. Baby can get tetanus due to bad umbilical cord care. Baby can die from low blood sugar without proper monitoring and nutritional intervention. Breastfeeding can fail to establish without integrated lactation support. Baby can suffer from blood type mismatches that won't be caught, leading to serious blood breakdown and rapidly increasing jaundice. Baby can suffer brain and tissue damage due to low oxygen levels not caught without running umbilical cord blood gases. Baby can get RSV and get hospitalized or die without immunization. All of the physical exam findings I mentioned can be missed, including cataracts, eye tumors, hip development issues, spinal muscle atrophy, heart murmurs, and more, especially if follow-up with a pediatrician is poor. And numerous congenital infections can be missed and treatment delayed, leading to death or lifelong disability. That's just some stream of consciousness, and by no means a comprehensive list. But rest assured that medically speaking, home births are a very bad idea for baby, and yes, there are many ways that it is a bad idea for mothers too. Alright everyone, here is the final result. Let me know your thoughts down in the comments below. I probably stepped on several more toes with some of my commentary on this one, but I'm fine with that, because prenatal and newborn care is extremely important. Overall, I am not that satisfied with the final result, unfortunately. The effect of the optical illusion isn't very strong, not as strong as I hoped it would be, and I just don't like the overall results as much in general, but that's okay. You win some, you lose some. I'll probably be taking a bit of a break from content for a while now, as my past several projects really haven't had much engagement or interest at all, and although growth or popularity aren't really the primary motivating factors for me, if nobody watches, then that means my public health messaging isn't engaging enough and therefore is not reaching anyone. And promoting public health is the primary motivating factor for me, so I'll have to take a step back and reconsider my approach. By the time you watch this, I'll also be on a multiple month stretch of busy inpatient medicine services anyway, so I won't really have time or energy to be making content, even if it was taking off. Anyway, hope you enjoyed, and if you did, please consider liking, subscribing, sharing, or commenting down below to let me know. Ciao.